Okay, good evening, everybody, and happy Pride. On this last day of Pride Month, we're going to be talking about sexual health. So, welcome to Conversations with Dr. Lou and Friends. This is Dr. Trina taking over just for today for Dr. Lou in celebration of Pride Month with MCC. So, again, we're going to be talking about something that is relatable across all genders, but is often treated as something shameful rather than something that is part of the regular human experience sex. So, a lot of it is considered to be shameful when, again, I will never be tired of stressing that it's actually normal. Sex is normal. So, to help us talk about that tonight, we have Dr. Winlove Mojica. He is a dermatologist, best known online as the Skin Sensei. Okay, so we were our schoolmates in the UP College of Medicine, where we are both professors. Okay, so he is also the assistant training officer of the Department of Dermatology in UPPGH, and he actually went to Singapore to study sexually transmitted infections. Okay, so good evening, Dr. Winlove.
Good evening,
Welcome.
friends. Thank you for having me. Always a pleasure to be with you.
Yeah, I miss you. So it's so nice to be here together and doing work but not work.
Oh, yeah.
Everyone
Chika
will
lang.
love
Chika
talking with
lang.
me. Love. Yeah. Okay. So if anybody has any questions, comments that they'd like to bring up, uh, please feel free to use the chat box. We're here for you. All right. So let's start. As with any intimate encounter, at least the ones that are more enjoyable, introductions and foreplay are very useful. So let's put our conversation into context. Dr. Winlove, what is sexual health?
Sexual health, according to the WHO, it encompasses sexuality, the sexual activity, and even relationships. No, when people are sexually healthy, they can have pleasurable and safe sexual activity without coercion, discrimination, or violence. For people to have good sexual health, it actually depends on four things. Number one, their ability to access the correct information about sexual health. So, tama ba alam ba nila kung saan kukuha ng information at tama ba yung information na makukuha nila? Number two, knowledge about the consequences of sex. Of course, sex is pleasurable, but they also should know the risks and the consequences after having sex. So, kung babae sila, alam nila na after sex, pwede silang mabuntis. So, dapat alam nila yon. Number three, their ability to access care or alam ba nila kung saan pupunta at kaya ba nilang puntahan yung isang healthcare facility where they can get sexual health services. And lastly, do they live in an environment that is sex positive or promotes sexual health? So kapag lahat yung mga bagay na yan are present in the environment and in an individual, then we can say that somebody is sexually healthy. Now, sexual health has intertwined relationship with many national issues such as teen pregnancies, abortion, sexually transmitted infections, HIV, child and maternal mortality, and even domestic violence. So it's a very complex matter. That's why we need to talk about it.
Oh, I completely agree. So we actually need to talk about it for sexual health and even for national health, personal health, and well, yun nga, just to be able to take care of ourselves physically and actually even mentally. So,
Correct.
so sige. Dr. Willow, for you, how does sexual health affect one's mental health?
Of course, uh, sexuality is part of sexual health, no? So sexuality is an integral aspect of every individual. Lahat ng tao may sexuality. Now, if your sexuality is not accepted by the people around you, that brings anxiety to you, no? Sometimes people will be parang okay lang, wala akong pakailam sa inyo. But there are other people who will really give a lot of thought about what others would say, no? And that will bring a lot of anxiety. And when there's a lot of anxiety, people usually tend to be uh, more influenced, mas mataas yung peer pressure sa kanila. So, mas mabilis magyosi, mas mabilis lasing, mas mabilis maging hypersexual kasi you're looking for something pleasurable or something to fill that void na hindi mo natatanggap sa paligid mo, no? So, knowing sexual health is integral in maintaining your mental health.
Agree, agree. From a psychiatrist's point of view naman, it's two things eh. Sometimes sex is a symptom. In other words, ga, as you mentioned, hypersexuality. Yun nga, it's an expression of something, an expression of distress, or a way of coping that is not always necessarily safe. But
Mm,
what is actually just as common as those is the shame of it. Nasi-stigmatize lagi eh when we talk about sex. Sa
yes.
experience mo, Dr. Winlove, what are common misconceptions about sex, gender, and sexual health that are stigmatizing?
Well, since I started learning more about sexuality in 2017, 2018, I realized that people are so stuck up with the concept of a man and a woman. What is a man and a woman? And it's usually based on the genitals, sa penis, sa vagina, sa titi, sa pekpek. No, if I could say that on air. Uh, Isa yun sa mga misconceptions na yung lumabas kasi yung term na SOGSC, no? And yung SOGSC, usually ang mga nagsasabi niya na dapat aralin is mga LGBT. So isa sa mga misconceptions ay yung SOGSC or yung sexual orientation, gender identity and expression, and sexual characteristics. Yung term na yan ay reserved daw for LGBT, which is not true. So GSC is parang an expounded version of sexuality, no? Parang uh, chinop-chop mo siya para mas maintindihan yung sexuality. And since everybody has sexuality, it means everybody has SOGSC. So SOGSC is not just for the LGBT, it is for everybody, man, woman. Okay. Another misconception is that there is a right and a wrong sexuality or SOGSC. 'Di ba? Kaya nga tayo maraming nachichismi sa atin, maraming kaguluhan na nangyayari sa paligid natin about regarding sexuality kasi iniisip ng tao dalawa lang ang sexuality, lalaki at babae, no? And kapag wala ka dun sa norm na yon, mali yung sexuality mo. Abnormal ka, hindi ka katanggap-tanggap. Or masusunog ka, you're going to hell. Mapupunta ka sa dagat-dagatang apoy. So that is one misconception. There is not one correct SOGSC. Actually, all SOGSCs or sexualities are valid. Okay? And last na may isip ko na misconception is that women are solely responsible for sexual health in a relationship, which is not true. Kasi nakikita natin yan, especially in the Philippines. Ba? O mag-family planning kayo kung ayaw niyong mabuntis or madagdagan yung anak ninyo. Pero yung decisions, yung mga responsibilities, usually nakalagak lang sa babae. Like for example, siya lang yung nagtitake ng oral contraceptive pills. Diba? Sasabihin na, ikaw dapat ang mag-control. Diba? Ikaw ang mag-insert ng IUD, ikaw ang mag-inject ng hormones para hindi ka mabuntis. When in fact, sexual health is also is also a responsibility of the male in the relationship or whatever relationship you are in, dapat dalawa kayo. Or para dun sa mga polyamorous, kayong tatlo. Responsible kayo
Kahit
dun sa,
ilan man kayo.
sa sexual health ninyo, di ba? Hindi lang isang tao.
Oo.
So for
Oh,
example,
that's so interesting kasi sexual health doesn't just cover preventing pregnancy eh. Diba?
yeah, correct. Isa pang
Oh.
misconception niya na parang sexual health is just about pregnancy, no? Marami pang iba. It's also about protecting yourself from sexually transmitted infections, from cancers, diba? From pain, from unpleasurable sex, painful sex. So, para dun sa mga babae na hindi swak sa katawan nila or hindi match sa kanilang katawan yung hormones or yung mga ibang procedures for them not to get pregnant. So the guy should take charge na siya ang maging in charge din dun sa kanilang sexual health, ano, sa kanilang relationship by possibly doing a vasectomy or uh, using condom correctly and consistently. So yan yung three things na niisip ko na misconceptions about sexual health. And isa pa pala, yung sexual health ay deals only with sexual activity, with sexual positions. Kaya maraming mga tao na, no, we should not teach sex ed in schools because it's bastos, no? But we don't teach sexual positions in sex ed, in sexual health
Actually,
issues, no? Di ba? Isang misconception.
true.
Yeah.
True. Ano, ang galing at ang lalayo pala. It seems like there are a lot of things that we seem to know that we take for granted.
Correct.
So, galing. Sige, so given all of those misconceptions na ang lalayo pala talaga, how can we combat this?
Of course, we can combat yung mga maling information, and then itong mga maling information na nangyayari, nagli-lead sila sa stigma and discrimination. And kapag may stigma and discrimination, may abuse. So para matapos yan, kailangan well-informed lahat ng mga tao. Di ba sinasabi nga natin that fear is a result of people not understanding something. Diba? Kaya tayo natatakot kasi
Mm.
hindi natin siya naunawaan. So paano natin maunawaan? Kailangan natin pag-usapan. So we need to talk about sexual health more often or possibly every day, no? And we need not go far. We can start with our families. And yan nga yung trust ng iba, parang sex ed starts at home. The parent is supposed to teach the children. Pero ang comment ko doon, paano kung mismong parent they don't know sex ed. Hindi sila naturuan ng maigi ng sex ed. So one of the
True.
assignments of parents is they should be able to read up online about sexuality and sexual activity. Magkakaiba yun na sexuality, sexual activity, and relationships. Because eventually your children will grow into adults and they will all experience what you experience as teenagers, di ba? Your raging hormones, you being attracted to possibly more than one person of different genders. So children need guidance. And how can you give guidance if you yourself you don't know what to teach or what to talk about? So there are many resources online, reputable sources online. So let's encourage our parents to read. Okay, hindi lang yung parang magtuturo sila based on stock knowledge. And usually yung stock knowledge natin about sex is mali, ano? Kasi ngayon pa lang naman tayo nagkakaroon ng availability ng information sa internet unlike ng mga naunang generation na talagang wala sila masyadong information. So yeah, can start at home by empowering our parents and katulad ng sinabi ko kanina, the definitions about SOGSC, no, yung sexual orientation, gender identity and expression and sexual characteristics. Mahirap siyang intindihin. So dapat as an adult, magkaroon ka ng idea. Pero hindi rin mo naman i-explain yung SOGSC sa 3-year-old kid. Kasi hindi niya yun talaga may intindihan. So how do you explain sexuality to a 3-year-old kid? It can be as simple as saying that these are your hands, these are your feet, and this is your body, this is your boobs, this is your genitals, ito yung this is your penis, this is your vulva, and this is your body. And nobody should be able to touch it without your permission. That is already age-appropriate sexual education. And we should also teach children, aside from respecting asking people around them to respect their personal space, dapat they should also be able to respect the personal space of others. So yeah, so yung starting at home. Now, aside from starting at home, we should institutionalize sexual education, ano? Kasi kailangan systematic yung pagtuturo mo sa kanya. So it should be part of the curriculum. Fortunately, it is part of the curriculum of DepEd. So I was fortunate enough to be able to write a series of
Oh,
chapters ng ano. So
wow.
nakita chapters ng para sa MAPE, Music, Arts, PE, and Health. So dun sa health chapter. And nakita ko talaga na scrutinize ko yung curriculum ng DepEd for Health. maganda siya. Kaso ang problema, naituturo ba siya ng tama? So again, aside from empowering our parents, in institutions, we should empower our teachers. They should feel competent and confident to teach sex education or sexual health. Kasi kahit na nandiyan yun sa libro, kapag yung magtuturo, hindi siya competent, or parang siya mismo magigiggle, di ba? Walang matututunan yung student. So, I think these are two simple things, simple but difficult things that we can do to fight to change these misconceptions, to fight misinformation, disinformation, and then eventually to combat stigma and discrimination and prevent abuse.
Okay. Yung sinulat mo for for the MAPE classes, ano yun? Pang high school ka agad?
Oo, ang in charge sa akin grade 9 and 10. Uh, Actually, medyo hindi tungkol sa sex ed yung part ko. More of community health, population health, ganyan. Pero meron dun portion na parang how to be a good, a knowledgeable consumer. Part yun dun sa health education. So parang getting information. So nakasulat doon at sinulat ko doon na parang not everything you see and read online is true. So there are different levels of evidence. So dapat marunong ka rin mag-categorize kung parang, ito parang dito lang to nang galing tong information na to. So parang this is a before and after study. So low level of evidence yan in comparison to randomized controlled clinical trials for humans. So parang ganun yung part ko. But in a way, I was able to inject uh, items on sexuality, HIV, yeah.
Okay, galing. So, sige. Pero I'm hearing, no, since we talked about how to explain beginner sexual health to a 3-year-old, it sounds like something that we can actually gradually build on, no? Even through grade school, through high school, and sige, even in adulthood.
Correct, correct. Oo, hindi naman siya parang one-stop shop na upo ka ng 6 years old, alam mo na yung vas deferens, yung epididymis, di ba? Parang hindi nila may intindihan yun. So dapat
Yeah.
age-appropriate yung sexuality education.
Okay. What about may advice ka ba for parents who instead of being able to sit their children down to talk about it, what if bigla silang tinatanong, where do babies come from?
Ah, actually, it's a difficult question, ano? Lalo na kapag hindi ka talaga prepared. Well, based on my readings, you just have to be truthful. Kasi yung pag sinabi mo na pupunta siya sa store, ganyan, di ba? Yung parang dinadala siya ng store. Parang hindi siya truthful. So parang you can chop it down na parang a man has a body part. I don't know. I don't know, Trina. Yun yung unawa ko na parang be truthful, parang don't make it something fantastic na unrealistic. So,
Agree.
yun. Ikaw, you have more expertise in that, in that
Yun.
aspect.
Actually, ako rin nagulantang dati because my niece asked me in the middle of the street.
Oh.
O yun. So, pati ako nagulat. So, disclaimer, adult psychiatrist kasi ako not a child psychiatrist. So, yun. So, bigla ako napilitang aralin kung paano. Kasi sa totoo lang, ang sinagot ko noon was, science. So, syempre, that actually was not a very good answer. So, later on, yun nga, tama ka, don't make up stories that will just serve to confuse them. Tamang you talk about the body parts. And then, ako personally, I also tend to put it in the context of the child's parents and how because they love each other, they express their love by having sex. And then
Mm,
and
yeah.
then tuloy-tuloy na, then I go into pregnancy.
Yeah. Oh. So
Yeah,
parang
so
when you are old enough, your body changes, and pwede yun. When you are attracted to someone or when you love somebody, then you can have sex. So when you have sex, a body part is inserted to the vagina. the penis is inserted to the vagina, and then the baby develops inside the mother. Ayun, pwede yun. Pero
Yun. So,
it depends din kasi
true.
upon how you start off with your kid eh. Kung okay lang sa inyo mag-usap na about body parts. Kasi most parents do not talk about that body part, 'di ba? Oh, so
Oh,
how can you discuss complex issues if you have not discussed simple body parts? So discussing simple body parts like your hands and your feet, usually alam lahat, hands and feet ganyan, pero pagdating doon parang wag natin siyang pag-usapan. So mas maganda you be open na this is your tite, this is your penis, okay? That is yours. Do not allow anybody to touch it. Oh. 'Di ba? Kasi it can be as simple as that. So, nalalaman nila na, hindi pala dapat ginagawa sa akin ito.
oh,
Kasi,
that's true.
some adults parang play sa kanila yun na kikilitiin sila in parang in their
Doon.
nether regions, ganyan. Para sa
Totoo,
adult,
totoo.
parang baliwala lang yun. Pero kung alam ng bata, oops, this is my my private space, di ba? Alam niya na yun.
Oo,
So, before
oo,
they can discuss complex issues, dapat yung mga simple body organs, alam ng bata. Parang
oo.
walang mali siya sa kanila.
Totoo. Yun yung problem eh, yung mali siya talaga. Sige, so I'm hearing, no, the parents have to set the stage and the parents have to be able to tell the truth in an age-appropriate way.
Correct.
Okay, so galing, galing. So for the next part of our discussion, we go into safe sex.
Mm.
All right? So uh, let's start with are there things that we can do for ourselves for better sexual health even before we have sex? Anong
Yeah.
pagpe-prepare ba ang kailangan?
Definitely, di ba? Pag pupunta ka sa gera, hindi ka mag-aaral doon kung nandun na yung kalaban mo, babariling ka na. You have to study before you go to any battle or for any endeavor for that matter, di ba? Knowledge is power. Or sabi nga dun sa, may favorite movie ako ni Tom Cruise eh, uh, Tomorrow, I keep forgetting that. Basta yung may kalaban sila na aliens ni Emily Blunt na nare-rewind yung buhay nila.
Ah,
I
ah,
forgot. Edge of Tomorrow, yeah.
yes, I
So
think
parang
so. I
they
think
were
so.
only able to beat the alien when they learned how the alien works. So you have to know how your enemy works or how to protect yourself before you can protect yourself. So dapat alam mo kung sino yung kalaban mo. Alam mo kung ano yung kakaharapin mo bago ka man sumabak kung whatever man yun, endeavor or laban man yun. Ano. Kasi hindi ka talaga mananalo kung hindi mo alam kung ano yung gagawin mo, ano yung kakaharapin mo. So, um,
Agree.
so before ka makipag-sex, these are some of the tips na-gather ko based on personal experience, um, stories ng mga kaibigan ko na tinitreasure ko until now, no? Na natutunan ko na very valuable. Number one, do not do anything that you are not sure of. Kapag hindi ka sigurado na gusto mo o hindi ka sigurado na komportable ka at ang sagot mo dun sa tanong mo, gusto ko ba to or komportable ako dito at ang sagot mo ay hindi clear cut na yes. Kapag maybe, I usually know yon. So don't do it. Para
Oh,
hindi ka
okay.
masaktan. I don't know kung ano yan. That's a good, what do you call this? Tip from a psychiatrist perspective. Pero makes sense. Kasi if you're not sure, usually, the answer is a no. Even in relationships. If you're not, based from my experience, if you're not sure with somebody, parang, gusto ko ba siya? Gusto niya ba ako? Will this work? If it's a maybe, it's usually a no.
It might be
That's
ano. Actually, I
that's
agree.
from my experience.
Actually, interestingly enough, I looked after someone before na pinag-usapan nila ng boyfriend niya at the time na hindi sila magse-sex.
Mm,
So, yun. So, that was interesting. Eh, I had this other friend naman na sabi niya, hindi ba ang sex? It's a sudden thing. It's a sudden
mm,
decision. So, yon. So, it's very interesting for me na nagka-clash yung ganun. What are your thoughts on that?
And hindi ko na-gets yung ano, yung thought. Sorry,
Yun. No,
rephrase.
kasi, no, here we have a couple na pinag-usapan nila hindi sila magse-sex tapos. And
Tapos meron
then,
isang couple naman na,
di ba biglaan lang yun? Pag nagtatagpo lang ang init ng katawan nyo na yun.
well, anong tawag rito, case-to-case basis yun, ano? Kaya nga,
Agree.
going to the next step, be upfront with your partner. So, sabihin mo kung ano yung mga kaya mong gawin at hindi mo kayang gawin, what your expectations are. Alamin mo rin kung ano yung expectations niya. Not just with sex, no? If this, even in relationships, or are you, to begin with, are you in a relationship? So parang, yung iba kasi, marami kasi sa kabataan na parang they'll have sex thinking that they're already in a relationship with somebody. Tapos yung other party naman, parang no, it was just sex. Or parang, pwedeng multiple times tayo nagsisex, pero wala naman tayo pinag-usapan ng exclusivity. So, may nasasaktan. So, from experience and the
True.
experience of my gay friends, it's best if you have a clean slate and you uh, lay the cards on the table clearly na this is just for fun, okay? Or we are doing this as two adults or two individuals or planning to have an exclusive relationship, or we are doing this because we are in an exclusive relationship. So be upfront. And yun nga, so parang bukod sa pagkakaroon ng being upfront, of course, decisions can change, no? Situations can change. Maaring at the start of the relationship, sinabi nila they won't have sex. Tapos biglang yung isang partner, nakaramdam siya na, ay grabe, sobra yung physical attraction ko dito. Tapos sinabi niya na I want to have sex with you. So that's another point of ano, parang decision making, no? So maganda yon na pinag-uusapan niyo as you go along. So parang walang hard and fast rule na at the start doon lang tayo magde-decide. So parang it's a constant evaluation of your values, your desires, yan. So mas maganda na to keep an open communicate your lines of communication with your partner or your sexual partner. So yan, yun
Okay.
yung isa sa
Amen.
mga iniisip ko na parang maaring at the start, no sex, tapos parang midway, sabihin ng isa na gusto niya mag-sex. So reevaluate kung kaya mo, kung hindi mo kaya, sabihin mo sa kanya, at least you're upfront. Kung magpatuloy pa rin yung relationship niyo despite na hindi mo kaya makipag-sex at gusto niya, then well and good. Kung hindi, well, that's the point of dating. You find a person who is a good match for you. So, ibig sabihin, that match
Agree.
isn't good for you. Oh, di ba, Trina?
Back
So,
gunner.
yeah. So, yan yung mga prerequisites before you get into a relationship or before you do sex. Don't force yourself into something that you're not comfortable with. Next is read up on things that you can get or things that can happen to you during and after sex. Para hindi ka nagugulat, di ba? For example, uh, I'm gay. So, ibig sabihin, I'm attracted with, I'm attracted to other men, ano? And there are men who, like other men who are gay and who would do anal sex, no? So, pinapasok yung penis sa puwet, PT sa puwet. Now, if you are not knowledgeable na pwede magkaroon ng poop, kasi puwet yan eh, di ba?
Yeah.
So, tapos, you are a bottom. You are the bottom in the relationship. Ibig sabihin, you are the partner na pinag-insertan ng penis. And then you haven't heard of douching. Di ba? That's going to be a humiliating experience for you and for your partner. So read up. Di ba? Prepare. If you already decided that you will have sex, then prepare more. What are the preparatory things that I need to do to enjoy this moment of sex? So read up. Next is don't shave. Ito very scientific. Don't
Oh,
shave. Oo.
okay.
A lot of
Why?
individuals, they abhor hair. Ako baliktad. I'm very attracted to hairy people. So,
Okay.
yung iba, ayaw nila kasi parang madumi yung field. Hindi nila madilaan or parang it gets in the way, it chokes them, it
Oh,
gets in their teeth, di ba? Parang ganyan. So, they shave or they ask their partners to shave. Now, when you shave, you produce nicks in your skin. Ano?
yes.
Nagkakaroon yan ng
Oo.
small
Oo,
cuts.
nasusugatan
And
ka
these
eh, yes.
cuts, and these cuts need not to be perceptible, no? Hindi naman yung biglang maglalabas ng placard na I'm here, there's a cut here, no? So, maaaring hindi mo yun nararamdaman. And when
Oo,
these
true.
cuts are there, and when your partner has a sexually transmitted infection na maaring hindi niya rin alam na meron siya, mas mabilis makapasok yun sa skin mo. And that's the reason why
Oh.
uh, most of my patients who have genital warts usually have a history of shaving, no? And genital warts, molluscum, ganyan. So, avoid shaving. So, if you want parang less hairy, don't shave. Just trim. O kaya, use an
Trim.
electric
Galing.
shaver na may guard, na hindi siya yung parang razor na regular razor ng mga lalaki.
Oo.
So, ganun yung
Okay.
gamitin. Ayan. So, yun yung mga tips before. Now, tips
Galing.
during sex, aside from enjoy the moment, be vigilant pa rin. Okay? You can still enjoy and at the same time, be vigilant. What do I mean by be vigilant? When you're wearing a condom, hindi lang yun yung parang isang oras kayo nagsisex, isang oras mo rin yung suot yung condom. So every now and then, you have to check for the condom's integrity. And you have to use it consistently and correctly with a water-based lubricant. Just for those individuals who do not know yet, condoms are not compatible with oil-based products like body lotion, baby oil, ano pa, mantika, mapupunit siya. So, kailangan water-based lubricant. Okay? Yung KY Jelly is a
Oh.
water-based. Marami pang cheaper na water-based lubricant sa mga drugstores. No? Basta hanapin nyo water-based. Kasi masisira yung condom. So parang wala kang protection, mabubutas siya. So mag-spill out yung contents, ano tawag dito, yung semen, pwede maghalo yung blood o kaya yung feces. So can be messy and it can predispose you to different more serious sexually transmitted infections, no, like HIV.
Okay,
So,
so
yes.
important to read the labels pala of your lubricant.
Yeah, most naman are water-based. Pero kasi
Okay.
yung iba, they don't bother getting water-based lubricant. So parang kung ano lang meron sa kusina, hindi pwede yun.
Oo, pero
Nasisira yung condom. Sa
oo,
probinsya, usong-uso yung paggamit ng cooking oil. Kasi 'di ba? Parang intuitively, madulas yung mantika. Tapos sige mag-condom. Pero masisira yung condom sa cooking oil.
oo nga,
Mapupunit
ang
siya.
galing. Oh,
So be
okay,
vigilant
oo, be vigilant. Okay, yun nga,
during and
during
you
sex.
have to replace the condom for every sexual encounter. Like for
Oo,
example, there are women who would practice and would enjoy anal sex. So hindi ibig sabihin naka-condom nag-anal sex tapos naka-condom pa rin, same condom, tapos mag-vaginal sex. Hindi pwede, mag-pelvic
oo.
inflammatory disease yung babae kasi
True, true,
mapupunta yung bacteria nung puwet sa vagina niya. No? So you have to
true.
replace that. Also, ideally, you have to use condom during oral sex kasi you can also transmit and get sexually transmitted infections during oral sex like gonorrhea, syphilis, so herpes, pwede din. So, I know parang what? Oral sex na nga lang may condom, yun ang totoo. But ayan, kung alam mo na you can get an STI by not using a condom during oral sex and you still performed oral sex without condom, it's an informed decision. You're willing to take the risk. O, di ba?
True, true. Dapat
Yan.
trust mo yung partner mo. Pag ganon.
Yun, yung trust the partner, mahirap din yan, Trins. Kasi even the most trustworthy partner, minsan, hindi rin nila alam that they have an STI. Kasi for
Oo.
example, uh, serial monogamy. So parang they will have sex pero silang dalawa lang. After nung kunwari natapos yung relationship, di sila nagkasundo. So another partner, di ba? Tapos silang dalawa lang. Pero kahit na serial monogamist ka, serially you practice monogamy, may sinasabi tayo na once you have sex with one person, you have sex with all of the persons na nakasex nung tao na yun.
True,
So,
true.
kahit na monogamous kayo, pwedeng may STI pa rin yung partner mo, hindi niya lang alam.
True.
Kasi some of these infections are subclinical or they're not clinically visible. Ano? Malalaman mo na lang na meron palang STI yung partner mo pag nakuha mo na siya. So,
Ay, that's
that's the reason why most of my HIV patients get parang that's how most of my HIV patients got HIV kasi parang doc I trusted this person eh mahal naman namin ng isa't isa tapos monogamous naman kami so
oo.
yun yung monogamy is not 100% um, barrier for sexually
Totoo.
transmitted
Okay.
sexually
Oh, that's
transmitted.
very important pala. So be vigilant talaga. Okay, we have a question from the audience.
Okay.
Okay. Yun, sa, are there sites that we can suggest that does not promote promiscuity and are values laden?
Sites. Um, well, ang mga magagandang sites to read about sexual health is the WHO. So you just type WHO, tapos sexual health, lalabas na doon. Um, maraming resources about HIV online. Kasi you have to change your perspective about promiscuity and sex. Kasi sex is natural and sex is beautiful. You have to tell that to your child. And you have to tell your child that you would want to have sex. And I hope by that time that you do have sex, you already have the information. No, honestly, walang bata, walang anak ang magsasabi na nay, tay, excuse me, I'll be back by 10 p.m. I just have sex. They will never ask your permission, di ba, Trins? Have you heard of a
Oo
child na,
naman.
ma'am, mom or mama, this is the first time I'm going to have sex. So please chill or parang give me baon. Bigyan mo ako ng pamasahe. They will never tell you. So the most that you can do is parang teach them before that time comes that they decide on their own that they will have sex. You don't know when they will have sex. Lahat tayo, ang gusto natin, parang our children will delay the sexual
True.
experience. Parang ano yan, di ba? Parang napaka-intuitive niyan. Parang hanggat kayang ma-delay, di ba?
True.
And actually, children who have very effective sexual education do delay their sexual debut. They
Oo.
are able to delay their sexual debut.
True.
Kaya nga, dapat, kausapin natin yung mga bata, no? Parang, yung fear kasi na baka maging promiscuous, the more na hindi mo pinag-uusapan, the more na nag-iisip ng kung ano-ano, the more naghahanap ng ibang channels of information, ano, sources of information. And usually, yung available sa kanila is pornography. So yun ang nakikita nila. Ano bang malay ng mga bata sa World Health Organization sexual education website, 'di ba? 'Di ba? Hindi naman yun ang pupuntahan nila kasi that does not steer their interest. So yun tuloy ang naiintindihan nila. Dapat ganito pala ang sex, no? Parang dapat nananakit. Parang usually mga nakikita natin sa porn, parang fantasy yun. So, ang feeling tuloy nila ngayon, parang their partner should be subjugated to violence and ano. So, yan. So,
So, pwede bang dun din nila natutunan yung promiscuity?
yeah. Oh, correct. Totoo.
Okay. Sige. So, tama pa pagkaintindi ko, we should be able to go to the WHO site for sexual health education, which, syempre, WHO, the site is pretty straightforward and basic.
Yes. Oo.
And
Tsaka,
it does,
um, WHO, CDC, diba? All these health sites, they have reputable sources. Tapos, the way they talk, merong page for physicians, pero meron ding page for lay. So, may intindihan mo talaga, ito pala yung mga sakit na pwedeng makuha, or ganito pala dapat yung approach ko when I'm talking to a teenager. Maraming tips for parents. Isa pang magandang website ay healthypeople.gov.
okay.
Healthypeople.gov. Parang ano yan, uh, parang agency siya ng UN. So healthypeople.gov, makikita nyo dyan yung sexual health, tapos how to talk to teens, how to protect them from mental, anto dito, substance use. So, kailangan talaga tayo yung mga older generation na marunong nang mag-access ng information. Tayo yung mangunguna. Hindi yung tayo yung parang passive lang na iniintay natin na lumaki yung ating mga anak na tsaka pa sila makakakuha ng information sa iba. So, tayo na yung magsiseed ng information, ng mga correct information sa kanila. And tingnan nyo, kapag you're open to your children about sex, parang usually talagang hindi sila sabik. Nakakapag-delay talaga. And that has been proven in many studies. Children who are taught sexual education, sexual health efficiently at a very young age, they are able to delay sex. They are able to resist the, parang nasisave sila from teen pregnancy and other vices.
Okay, galing. Okay, we have so thank you for that. Tapos in terms of a website that is values laden, so syempre, baka mas important kasi to be able to impart your values to your children. Okay, kasi I honestly can't name a site that has both,
Values, no?
let's say, religious values and
Yeah.
sex ed at the same time. So baka that might be a little impossible, and baka mas better then if you read the more scientific sources, integrate that into the value system that your family has. Tapos bigay mo sa children
Yeah.
mo para mas useful.
Oh, and at the same time, kahit naman mag-introduce tayo ng values sa children natin, our children will have their own values. Kasi maaaring makita nila, Mom, you value that, but I don't. Di ba? Or, Pops, you value virginity, but I don't. Di ba? May ganun eh. Na kahit
Oo.
nasabihin mo, dapat virgin yung mapangasawa mo, ganyan. Pero, doesn't matter to me. So, the value of your child might differ from the values of your child might differ from yours, and that does not necessarily mean you failed as a parent. It just says that people are different. Your child is a different individual. Your child is not your carbon copy, and you
Oo.
should
So,
accept that.
yun. So, you can start with a foundation for them, but in the end, it's their decision. And
Correct.
basta as a parent, you did everything you could, you imparted everything good that you had, then tapos na. Congratulations.
Yes. So we should stop thinking that we should live the lives of our children. We should live their lives for them. No? They have their own decisions. They should be able to make their own decisions for themselves. So kahit na anong sabi
Na-input.
mo, sila talaga ang magde-decide kung anong gugustuhin nila.
Agree. Okay, so we have a next question, no? How do you explain a same-sex relationship to a 10-year-old?
Oh, just say that sometimes people are free to choose who they love. Most of the time, they choose a man and a woman. How do I say this? Most of the time, you see people in love that belong to the opposite gender, man and woman. But a man can also love another man, and a woman can love also another woman. And that is normal, period. Di ba straightforward? Hindi siya masyadong dramatic, but people are able to love, and they should be free to love who they want to love. So a man can love a woman can love another woman, and a man can love another woman. And that is part of the normal spectrum of sexuality. And this is accepted as normal. Just
Oo,
this.
so just be straightforward. It doesn't have to be as dramatic as we see on TV.
Yeah, oo.
Especially, so kasi the fact that you are asking says so many good things about you as a parent or an uncle or an aunt or whoever that 10-year-old is to you. So, yun, thank you so much for that question. Ang galing.
I remember, meron akong inaanak, may tinanong siya sa pinsan ko, no, who I'm very close with. Parang, Ma'am, hindi ko maintindihan si Tito Lab. Bakit hindi siya katulad ng ibang tito ko? O sige, tanungin mo siya. Ikaw ang magtanong sa kanya. Tapos, nung
Wow.
pumunta ako dun sa bahay nila, tapos ako naman, the clueless me, biglang, o sige, ano na yung tanong kay Tito Lab? Tapos she burst into tears and told me, Tina Love, are you gay? Tapos takot na takot siya, iyak siya ng iyak. So ako naman, parang natutuwa ako kasi may conversation sila ng mother niya na gano'n, ano? Parang very open sila. Hindi, kasi older generation, huwag mo tatanungin niya, nakakahiya yan, ano? Oh, so
True.
parang, yun. So parang ako sinabi ko, yes, I am. So I'm attracted to other men. So ngayon, parang wala lang. Very straightforward. When my partner comes here, they know.
Okay, galing. So, ano, so let's not put in uh, more drama than it needs because nga, again,
Correct.
it's a natural part of the human experience. Not all humans, but definitely humans.
Yes, correct.
Hey, galing. So, sige, we finished talking about safer sex tips before sex and during sex. Alas, meron ka pa ng during sex.
Ay, meron pa akong additional na during sex. Di ko na rin nag-say yes ka na, no? You're allowed to take it back. You are allowed to say, ayoko na. And as a partner, you should respect your partner kapag ayaw niya na makipag-sex. Kumbaga parang napagod na ako or masakit na, hindi na siya comfortable. You are allowed to do that, no? And pag nagganon yung partner mo tapos pinilit mo siya, that is something else. Wala nang consent yun. So, if you're not comfortable at the start, don't push through. If you push through and you are not comfortable midway, don't push through and that should be fine. So after sex naman, trains would be, actually ito, even before sex din is, know your HIV status. Kasi, important yun eh. Alam mo yung HIV status mo. And pag alam mo yung HIV status mo, it doesn't mean na yung HIV status mo ngayon, forever yun yung HIV status mo, especially if you're sexually active. So, it's a wise decision to update yourself of your HIV status. Ideally, for sexually active, it's every 3 months. But most of us do not have time to do it every 3 months, do not have the resources to do it every 3 months. So
True.
I'm very lenient with my patients or when I talk, I say, kahit na once a year, ilagay mo siya sa birthday mo, schedule mo siya sa birthday mo so you won't forget. It's ideal if you also know the HIV status of your partner, but that is not a guarantee that you will not get HIV. Because like I said, if you get some STIs are subclinical, no? Maaring ngayon HIV negative yung partner mo, but di naman kayo magkasama 24/7. Hindi mo naman siya anino, hindi kanya anino. So kahit nasabihin niya pa sa iyo na I've been very very honest and faithful to you, you can never be 100% sure. Di ba? Can never be 100% sure. So your partner can eventually be HIV reactive or after a window period of 3 months from the first HIV negative test. No? So ideally, best if you two, pareho kayo, alam niyo yung HIV status ninyo. But that is not an excuse. Especially if, tao dito, how do I say, kasi for um, LGBT, walang marriage na LGBT. Eh. Yung sa mga heterosexual, may some sort of finality pag kinasal kayo, di ba? So parang, syempre, you want to get pregnant, tatanggalin mo yung condom for you to get pregnant. Sa LGBT, medyo mas mahirap sa amin eh. Kasi parang dahil hindi kami sanay sa culture ng kinakasal and parang the forever na magkasama kayo. So parang, sometimes mas madaling maghiwalay, di ba? So, bakit ko ba sinabi yun? Sinabi ko in the context na, help me Trina, sabi ko yun in the context na,
HIV?
about HIV. So parang, I forgot, oh my God, sorry.
Just because you're married, it's no guarantee.
Yeah, it's no
Yun.
guarantee. Yeah, correct. Just because you're with somebody you think who is
It's your
very
forever.
trustworthy, is your forever, it's not a guarantee.
Yes.
That's the reality of it.
Yes. Okay, so again, on a more on a more realistic basis and also to keep our bases covered. Okay?
Yeah,
So
correct.
sige, this is still during sex, no? No, sorry, after na pala siya.
After na.
Oo, so no HIV status.
Hmm.
Ano
Tapos,
pang tama?
okay, additional. So, just in case, for example, you're wearing a condom, the condom breaks, and hindi mo alam yung HIV status ng partner mo, you can avail of post-exposure prophylaxis. Previously, this was only reserved for healthcare workers, pero alam ko ngayon, it's available to the
Oo,
general population.
oo.
There's
I heard.
special clinics that can dispense post-exposure prophylaxis. So, it's a medicine for HIV, you take it for 1 month, just in case you get that accident. And of course, your regular what you call this, your regular HIV testing, and immediately after sex, you inspect the condom. Baka nga naman nasira. So para malaman mo kung you have certain actions to take. Kasi pag nasira yung condom, pwede siya mabuntis. So, kung ay mabuntis, do you need to take morning after pills? Or kung duda ka sa HIV status, do you need to take post-exposure prophylaxis? So, check the condom. If anything happens, you can get post-exposure prophylaxis. And then, of course, do your regular HIV and STI screening if you're sexually active.
Nice. Okay, so we have a question from the audience again. Is it a must to tell your suitor your HIV status bago maging kayo?
Well, it depends upon you. It really depends upon you how comfortable you are in disclosing your HIV status. Uh, it's very difficult because if you are PLHIV and you are not sure, if you most of the time PLHIV are not sure if they will be accepted in the relationship because of their HIV status. But you'll be surprised. There are so many numerous zero discordant couples, meaning one is HIV reactive, HIV positive, the other one is not. Why? Because of the medications now. And there's a study now that if you take your medications regularly and your viral load is undetectable, there is virtually no chance for you to pass HIV through sexual act. Okay? Even without a condom. So, proven yan, science yan. So, kaya maraming nakikita ngayon na zero discordant. Ibig sabihin, one is positive, one is negative. So, unlike before, very dramatic talaga na parang tatanggapin kaya niya ako. Hindi ko masabi, mahal na mahal ko siya, gustong gusto ko siya. At mahal na mahal niya rin ako, pero hindi ko masabi sa kanya kasi baka iwanan niya na ako. Pero ngayon, mas accepting ng mga tao, parang hindi na masyadong bigla, may HIV ka, okay. Are you taking your meds? Okay, that's good. Then let's move forward. Let's talk about something else.
Okay,
You
so
know, I have, if I may share, this
sure,
is
of course.
interesting. I have a friend who asked me, should I continue dating this person? You know, he's brilliant. I'm so physically attracted to him, and so is he to me. Kaso, he's HIV positive. And yung isang friend namin sabi sa kanya na, you know, kakaisip mo dyan sa HIV of being very, very happy with somebody you really, really like. So it's HIV is just another illness like diabetes. It can be managed now. So yung iba kasi parang hindi mo maaalis sa isip nila na purist na dapat walang sakit, dapat immaculate ang partner ko. But we are all individuals, di ba? We all have our story. So, napaka-enlightening nun sa akin. Oo nga naman. You might be missing your chance of being perfectly happy with the perfect guy because you keep on focusing on that HIV, which is properly managed. Na hindi ka naman mahaw because that person is taking his meds regularly. Ang ganda nung
Galing.
story niya.
Oo. Oo, kinikilig ako in my heart. Okay. Galing. So, sige, last question from our talking points, no? So, we're hearing about the importance of sexual health, getting educated, and tips on how to take care of yourself. Pero a lot of those pala involve getting in touch with a doctor eh. So,
Mm.
how can we approach a doctor about our sexual health?
Well, fortunately, there are more and more doctors who are sex positive, no? Especially the younger generation. Magtanong ka about genitals, ready na sila. Kumbaga parang napukpok na sa kanila itong sa training nila na dapat ready sila about sexual history. Yung mga, unfortunately, meron pa rin mga doctors na hindi. So one of the things that you can do is to do your research on who are these doctors who are sex positive or LGBT friendly, so that you'll have a better experience, no, in disclosing your problems. Kasi kahit nasabihin natin na matapang ka, tapos yung pinuntahan mo hindi rin naman open-minded, di ba? Parang the next thing you know, ayoko na tuloy makipag-usap because I had a bad experience. So it's a wise decision for you to research or have that network. Alamin mo kung sino yung mga doctors na pwede mong puntahan. And one good platform to do that is in Twitter. You can be anonymous in Twitter and you can just type something and shout out to the world who is an LGBT friendly doctor who can see a problem for this. Bigla may sasagot sa'yo, try this.
May sasagot. Meron sasagot. Okay, oo, kasama yan sa mga activities namin ni Winlove to connect our patients and our contacts to LGBT-friendly doctors. We
Correct,
exist
correct.
and we're a lot. We are legion, but come find us.
Ayan.
Okay, galing. What about what kind of sexual health services naman are available here daw locally?
Well, aside from the private clinics, we have our sexual, our hygiene clinics, no? Ito yung kung saan usually nagpapatingin for sexual health. Marami nang nag-improve sa mga social hygiene clinics. But sad to say, hindi pa rin lahat parang inclusive sa kanilang pakikipag-usap, and yung mga equipment nila hindi pa rin updated. So we have the social hygiene clinics, and of course we have certain clinics who specialize in SOGSC. No? The first clinic, Trins, is in Manila Med, correct?
Yes.
The first, parang, how do you term
Center
it?
for Center for Gender Diversity ba yun? I think
Yes.
that's what they call it. Oo.
TMC also has it, di ba? You head in TMC.
Oo.
Yeah, correct.
Oo.
So those are the,
Center for Gender Health and Wellness.
okay, naunahan pa kami sa PGH. Tagal-tagal ko nang gusto magtayo ng ganun. Hindi ko matayo-tayo. It's difficult. But yan pa lang. So konti pa lang yung mga centers natin specifically for LGBT. Pero meron ng mga centers for sexual health. Of course, pag sa babae, usually iniisip nila sexual health sa OB pupunta, sa paglalaki, sa urologist naman pupunta. Pero gusto ko lang i-add, pwede rin kayong pumunta sa dermatologist dahil kung hindi nyo man ho napapansin, lahat yan ay covered ng balat. So, pwede rin namin kayong tulungan sa inyong mga sexual health needs.
Totoo. Okay, so siguro a gentle reminder for everybody, no? Once you are sexually active, whatever your gender is, your sex organs are your sex organs. So whatever bits you've got, please take care of them. So, your LGBT-friendly doctors are here. And yun, it's just a matter of being brave enough to schedule that consult.
Yep.
Okay, galing. Meron bang clinics na hindi hospital-based, pero pwede rin puntahan?
Yeah. So, there's this network of clinics called Love Yourself. So they're a very active NGO, LGBT-friendly HIV testing center. And before they were just testing for HIV, but now they've become providers of ARVs, no? Nagre-release na rin sila ng gamot for PLHIV. So you just type Love Yourself. You can pick what branch, and they offer free HIV testing. So yeah, part yan ng sexual
Okay.
health services. So kung nagtataka kayo o natatakot kayo na baka mahal, tapos baka hindi friendly, mapahiya kayo, you can go to this center, Love Yourself. Tapos the service, the HIV testing is for free, and lahat ng mga tao dyan mababayad. And the clinic is very comfortable. Hindi siya dingy. Hindi siya nakakatakot. Hindi siya horror clinic.
Ay, important yun.
Oo.
Okay, so galing. So, Okay, so for this hour that we spent with Dr. Winlove, we talked about what sexual health is, why it's important to talk about sexual health, how we can promote sex education and sex positivity across generations. Uh, we also covered safe sex tips and also how to seek consults. So, thank you so much for this hour with love. Ang galing. It was
Thank
actually
you. My
so very
pleasure.
empowering to hear that as a woman, especially yung being able to say no at any time. Okay?
Yes, say no.
Alam niyo
When
to,
you're not
girls.
comfortable, say no.
Oo. So, ang galing. So, sa ngayon, dahil yung pinaka-take home ko nga ay, yun nga, stick to your comfort zone and stick to your comfort zone if you're unsure. And yun nga, you can say no at any time. For you naman, Winlove, what would you like the audience to remember the most from our talk?
Well, the most important thing is before you can understand others, you have to understand yourself. So you have to understand your sexuality. A lot of people, a lot of us do not understand their sexuality, and this has profound effects on our health, especially our mental health. And if you notice, yung mga pinag-uusapan natin, maraming mga problems on a national level ay dahil hindi natin naiintindihan ang ating sexuality. So take the time to read and understand sexual health because it will benefit you. The more you understand yourself, the more you can conquer the world.
Wow. Okay, so na-inspire naman ako.
I should
So,
listen to myself.
ay true. Ganyan din ako pag therapy. So, okay. So, uh, this is it for MCC Pride Month. Thank you so much for spending the last day of Pride Month with us, Winlove. Hindi ako magsasawang
Thank
mag-thank you.
you.
Oh, and everybody else, thank you so much for joining us. See you next month for our next conversations with Dr. Lu and friends. Na si Dr. Lu na talaga. Okay, so this is it for Pride Month Takeover. Thank you, everyone. See you.
Bye.